Rural palliative care is really quite different from its metropolitan sibling for a couple of reasons. One of them is the geographic location of many of our patients. Some of them live 20, 30, 40 miles away from the nearest healthcare facility. If they need higher level of pain relief care, such as getting certain types of injections, radiation therapy, many of them may have to travel an hour or even 2 round trip. And if you can imagine the patients who have to travel daily for radiation for weeks on end, that's a huge financial burden for many of them, as well as figuring out transportation, figuring out how to get there back and forth. Some other concerns are the poverty level. Certainly there is a lot of poverty in metropolitan areas, and it's a major issue in rural areas as well. Out here we have less services available, and we really rely more on our neighbors and the community perhaps than you might in a metropolitan area where you have a lot of extra philanthropic resources available. So out here we don't. Another not so obvious issue out here is cell reception. Many of our practitioners who are going out to facilitate care for some of our patients may not get cell reception. So phone reception in this area can be very difficult when you're very used to it in a metropolitan area to get help or to be able to do some things along the lines of negotiating care or trying to get somewhere. A lot of our patients live on minimal maintenance roads, and so it's hard for nurses and staff, physical therapy staff, et cetera, to come out and do home visits. Some of our patients are inaccessible during bad weather, completely inaccessible. Ambulance services for some of our patients, we know when we're getting called out to certain areas around here that it's going to be an hour before we see patients because of the difficulty getting to some of the patients during bad weather. Even in the summertime it can be a difficult thing. Other areas, other concerns out here that we just simply do not have nearly as many specialty trained nurses and physicians to give the care, and so most of this care really relies on primary care physicians, primarily family practice physicians. And specialty care might be a phone call away, but it also might be a visit, an hour visit away from someone. And so really trying to make sure that we have the family physicians and primary care physicians trained can be a helpful part, but it's very difficult because they have very full loads, often doing emergency room work, OB work, as well as active inpatient work. And so it can be quite a burden on some of the providers as well. But these challenges can also be the reason that creative palliative care works so well here and is beautiful. These communities and families, churches, come together to support a patient and their family, and that's why life is so good out in rural Minnesota.